Okay. Today I'm going to give a basic overview on the renal system, followed by a dissection of 2 kidneys, and finally finishing off with a description of a common disease that affects the renal system. Here's the timestamps just in case you want to skip to a certain point. Okay, without further ado, let's get started into an overview of the renal system. So this is a basic picture of the renal system. As you can see, there are 2 main veins that bring in the blood to the kidneys. The red one is called the abdominal aorta, and the blue one is known as the inferior vena cava. So these bring blood to the kidneys through the renal artery. The kidneys take that blood from the renal artery, and then they send contents to be filtered out through the ureter towards the urinary bladder, which then follows its way out through the urethra. Now if we focus on a picture more centered towards the kidney, we see that the blood comes in through the renal artery, which then flows through the kidney through various structures and then exits through the renal vein. Finally, the end destination for all this waste is through the ureter. Before I begin the dissection, I'd like to name some of the features on the outside of the kidneys. So as you know, both of these are known as kidneys. This white tube extending from the center of them is known as the ureter. Next to the ureter, there would have been a renal artery and a renal vein, but the butcher had removed them. Over here, the center where all of these tubes come in and out is known as the hilum. Had the butcher not removed them, the adrenal glands would have been towards the top. And this area outside of the kidneys is known as the lateral border. Okay, so without further ado, let's begin the dissection of both these kidneys. Okay, so now that we're done with the dissection, let's label some of the inner parts of the kidney. So once again, this white tube is known as the ureter. The area that it's connected to inside the kidney is known as the papilla. This mushy area over here is known as the medulla. Outside of it is the cortex, and the outer layer is known as the capsule. The disease I'm going to describe that primarily affects the kidneys is known as glomerular nephritis. Glomerular nephritis has symptoms such as blood in urine, foam urine, and swelling in the face or hands. The cause of glomerular nephritis is the glomerulus, which is located inside of nephrons, which is located inside of the medulla of the kidney, become injured by an infection or a drug. Once the glomerulus becomes injured, it inhibits its ability to filter out blood, which is why it results in blood being present in urine or having foamy urine. The people primarily diagnosed with glomerular nephritis are children ages 5 to 15, with the majority of them being men, and a ratio of 2 to 1 men to female cases. Having other diseases such as strep throat and diabetes are also known causes for glomerular nephritis. Thank you for watching this video. If you enjoyed it, please comment, like, and subscribe, and check out some of the other videos on my channel.